Hello, my name is Kamran Bhopal and today we're going to perform an arterial blood gas on a mannequin. How we do an ABG is go to the patient, do your greetings, and after that check the identity of the patient. The identity of the patient is Mr. John Smith, the date of birth is 14/5/1980, and we check the hospital number from the notes. And we confirm this information with the patient. After doing this, we do a test before an ABG. It's called the Allen's test. Allen's test is basically to check for any vascular compromise in the hand. So what we do normally in the Allen's test is what I'm going to show you on Dr. Sadaf's hand. We know that there are two major arteries that supply the hand, the radial artery and the ulnar artery. We occlude both arteries and ask the patient to open and close his fist and look for blanching. After that, we ask the patient to open his hand and look at the hand. We remove the thumb from the ulnar side and see if it reperfuses, which it nicely does, which means that there's enough collateral supply from the ulnar side and we can take the ABG from the radial artery. Okay, thank you very much, Dr. Sadaf. Now coming back to the patient. First of all, we prepare the clean area. This is the tray. Make sure the tray is clean. Go in the crevices to make sure that there's no blood or nothing left in the tray. Then we look into the things that we have. We'll take a pair of gloves. We'll take an ABG syringe, prepare it, and throw this in the clinical waste bin. We'll take a cotton wool, we'll take a tape, and we'll take an alcohol swab. Now coming to the main procedure. So, while doing an ABG, first of all we position the patient's hand. Normally we don't move the mannequin, but normally we have to make a certain position in which the radial artery is easily accessible and then palpate the artery. After palpating the artery, we take the spirit swab and clean the place. After which we take the syringe, palpate the artery again and go at 45-degree angle into the radial artery. And we'll see normally arterial blood will come gushing out. After we've got a big enough sample, we remove this, take the cotton wool and place it over here and make sure that the sharps are covered. We make sure that the sharps are thrown in the sharps bin and we cover the ABG syringe with a cap and remove all the bubbles. We have to place the cotton wool on the artery for at least 5 minutes, and if the patient is on anticoagulants, it may be longer. So we just take a cotton wool and stick it on the arm. And the rest of the things are thrown in the clinical waste bin. We have to make sure that we label the ABG syringe with the oxygen saturation and either take a sticker of the patient which will include the name, the date of birth and the hospital number of the patient, and run this yourself to the ABG machine and do the ABG yourself. Thank you very much. That was the procedure of performing an ABG on a mannequin. I hope you learned and enjoyed from it. Thank you.